I'm here to talk about how to wrap a baby. And many years ago, I invented my own way of wrapping a baby. When all you adults when you were all babies, your mums and dad probably put you on your tummy to sleep, and babies slept really well on their tummy. But after we realised with cot death, SIDS, all the information through SIDS, we know now that we had to put our babies on their back to sleep safely. In doing that, babies had their arms all around the place, and they didn't really go to sleep that easily. So I invented a wrap, and I called it Cath's wrap. My son always said, you have to do this, Cath's wrap. A wrap that was safely able to wrap a baby, make the baby feel comfortable, and help you with having a nice, comfortable, calm baby while you're breastfeeding and while the baby's sleeping. So when the babies have been inside the uterus, they're in that fetal position, that's all they've known. So they've been nice and calm and wrapped up within the fetal position, and so they feel very snug and safe. Wrapping helps the baby feel like it's back in the uterus, so it makes it feel very calm and safe again. So I invented Cath's wrap to help babies feel safe and to feed well to feel safe while they're sleeping and feeding. This is what a baby looks like in utero. So they're all wrapped up nice and tight within the uterus, and when they move, they've got the traction and they feel the uterus each time they move. So when they're outside, they need to feel something that gives them a bit of safety, and that's what the wrap does. So when do you wrap your baby? The baby needs to be wrapped for all feeds, and the baby needs to be wrapped for all sleeping. And that's just a collection of my wraps that I sell on my website. And that's midwifecath.com.au. Now, unfortunately, the video doesn't work. So I have my dear little friend here, someone, to show you how to wrap. The first thing is you need to have a very big wrap. It needs to be cool, not as in trendy, but light in weight. And it also needs to be big enough to wrap the baby. So you put the baby down over the wrap, and you put one arm down and you wrap right across its chest. You lift the baby up and tuck under its bottom. Then again wrap. And the aim is to have that arm, to wrap under the arm. So the baby can move its arms, because babies really need to move their arms. They don't like to be wrapped like this. No one does. The end part I call the mermaid. And the mermaid comes up, and you lift the hand up, and you wrap the baby around like that. So that's what it looks like. Babies have to do two things if they're being wrapped safely. One, they have to move their arms, and they have to be able to move their hips. So when a baby's wrapped like that, they can feed well, and then after a feed, you burp, 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 and then put down to sleep. So they stay like that. So the wrap has to be big, it has to be cool, and it has to be able to get around to the baby. So baby massage, we hear a lot about baby massage, and after a bath, those who have babies will understand, and people think that you have to keep a baby naked when you massage them. Sorry, baby. And so one thing is that babies don't like to be naked when they're just born. They need to be dressed and they need to feel secure. So the way I like to massage babies is after they've had a feed and after they're feeling calm and dressed. So you just massage them calmly on their back, nice and calmly, give their head a massage, nice and calm on their back. So they're not feeling frightened, because the aim of massage is to feel nice and safe. So that's what you do. They don't have to be naked. They have to be dressed and warm. And they love it. We had a little baby here yesterday, and she just lay here and she just purred. She was beautiful. So you do nice massage, nice easy massage on their head, on their arms, down their legs, little toes, and up their back. So it's a bit different to what you think it is, and it's really important to keep your baby dressed to massage. Now, lots of questions. No? No questions? Oh, well, I just get the muslin, which is really light, because the aim is to have, in winter, you dress your baby warm and wrap light. In summer, you dress your baby cool and wrap light. Okay, so you always keep the wraps. You don't put too many layers over it. That's what we used to do years and years ago, and we know that's not the right thing to do now. So you dress warm in winter, wrap light. Dress cool in summer and wrap light. Yep, good question. Anyone else got a question? Oh, how often would I massage a day? You know, I just would only once a day. It depends. If the baby's feeling really calm and feeling happy, you can do it as many times as you want to, in between, feeds and changing and things like that. It's just about having the baby calm and happy. If the baby's crying and needs a feed and a bit squirming, you don't want to upset it again. So just when you feel, yeah, and it's also good for your partner to do it, so that, they have the time of touching the baby and having some really good massage time. Yeah, good question. Massage oils. Well, when the baby's a bit older, but because I do it while they're dressed when they're very little, it's just, you don't really need anything. Because babies in utero they're in water all the time, when they come out, their skin's quite dry, but you don't need to put oil on them. Baby's skin is like a snake. They just lose the top layer. So in a few weeks, their skin's beautiful, but you don't really need any oil because you're just massaging. It's just the touch. It's just the feeling that they need. Yep. Yeah, usually on the front. You can certainly do on the back and do some time, but they might feel a bit sort of out of control on the back. But yeah, certainly can do if they're on the back. When they're a bit older, you can do on the back. They do like that. Yeah. Exactly. You can. The gentleman asked, "Can you do it on the change mat?" You can do it anywhere, on your knees, when the baby's on your shoulder, all that back. The thing that a lot of people do, they think when they're burping babies, they bang, bang, bang babies. Babies, they have to have gentle touch. So putting over your shoulder is a nice way to do the massage too. Yeah, good question. Anyone else got something to ask? Anything about labour? I can answer everything. As long as you're happy and as long as the baby's happy was the main thing. Yeah. Not too much. Just enough for the baby to feel the touch. Yeah. For swaddling, I wrap babies until they're 6 months for night time, for overnight. And then sometimes it's earlier. It depends if the baby's actually rolling. If the baby starts to roll earlier, I would unwrap, put the baby in a sleeping bag and let them roll over and go to sleep rolling over. Because you can't really police that. But if they're not rolling over, I'd wrap till they're 6 months.